Welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us here on the program once again. We're going to have a conversation with Dr. Candyce Kroenke. She's joining us to talk about some recent research concerning post-menopausal women and colorectal cancer. Welcome to the program, Dr. Kroenke.
Thank you.
Well, give our listeners a bit of background. I understand that you are working at Kaiser.
Yes, I work at the Kaiser Permanente Northern California Division of Research. And the research I do focuses on the influence of social relationships and concepts like social networks and social support on cancer outcomes and how that works.
Why is it so important that cancer patients engage themselves with social networking?
Yeah, I wouldn't say that this is necessarily all about social networking. A lot of this research that I've done started with prior work in interventions, looking at social support interventions in survival. And so because a lot of those interventions had sort of mixed uncertain effects or not very strong effects, I wanted to know about what the observational data, what cohort data had to say about how social relationships influence cancer outcomes. Mm-hmm. And so my work started over a decade ago, and with a specific paper that I conducted in the Nurses' Health Study, in which I looked at women's social ties, social network size, and breast cancer outcomes. And in that paper, I found that women who happen to have larger supported social networks happen to have better survival after a diagnosis of breast cancer. And so some of the work that I've done since then has been to try to replicate those findings in other cohorts, and I have done that. And so the work that we're talking about today is really this effort to try to understand whether or not these associations hold for patients with other types of cancer. This is about the influence of social relationships on cancer-specific outcomes, although I would say that some of what we're finding for cancer outcomes definitely has ramifications for other illnesses as well. And we're really trying to understand what is it about social relationships that influences outcomes. And so one of the aspects of that is that we're looking at the different types of social support, for example, that are brought by women's social relationships and their social ties, such as family and relatives and their participation in community organizations and religious organizations, and of course, spouses and partners, and how all of those people that are a part of their lives can influence outcomes either for the better or for the worse, and how it works.
How can interaction be negative? What types of things should we be looking at in ourselves when we're talking with people who are dealing with cancer?
Right. On balance, I will say that in the studies that we've conducted, women's social relationships tend to be salutary and have beneficial effects through a variety of resources and types of social support, or through expectations for behaviors that'll help them to manage their treatment and to get better. There are times when social relationships can have an adverse effect on health outcomes, and I'm thinking back to a paper that colleagues and I had done looking at the effects of social relationships on outcomes in caregivers and in people who happen to have highly socially strained relationships. And in that particular study, I did find that there was some evidence that larger networks could actually be a problem for people who did have a lot of burden in their relationships. But on balance, I would say that the majority of findings have supported this idea that people who happen to have high quality relationships, greater social support, and a larger network of people to draw that support from have better outcomes.
Were the outcomes affected at all by people who had, as you say, kind of a strained social lifestyle? Did they improve their social interactions after diagnosis?
So in that particular study, that's not something we were able to look at. In the current study in which we looked at social support social networks and colorectal cancer outcomes. We didn't really find evidence that social strain was involved in these associations. And in this particular, this most current study, we found that women who happened to have low social support had actually poorer survival. What we don't have and what we didn't report on in this study is how those relationships changed after diagnosis. Mm-hmm. And so this specifically referred to aspects of social relationships that we measured prior to diagnosis and their influence on outcomes after diagnosis.
So have you determined the effects on women that are diagnosed with colorectal cancer? You say a higher survivability rate with positive or I guess enhanced social interactions as opposed to the ones that don't necessarily have an active social lifestyle. Well,
I mean, it for people who don't have an active social lifestyle, those people may not have a lot of relationships or may not have strong relationships, and that does matter. However, there can be people who happen to have a lot of relationships, and if those relationships don't support them, then they could have poorer outcomes. But again, I would just sort of reiterate this idea that the women that we've looked at in a variety of cohorts generally do have better outcomes with large supportive networks.
As far as better outcomes are concerned, I know there is survivability, but what about quality of life during that survivability?
Absolutely. Yeah, that is definitely something that we have started to look at in some of our work. And we have looked at that outcome expressly. And part of the reason is that quality of life is an important in and of itself as an outcome. And the other thing is that we've noticed that physical quality of life dimensions tend to predict survival as well. And we've found really actually quite strong evidence that women who have larger social networks and greater social support do have better quality of life after diagnosis. The other thing that we're also looking at is we're looking at a variety of mechanisms. So we want to know how this works. So some of the outcomes that we're looking at in addition to quality of life and survival, we're also looking at treatment outcomes, in part because we want to know, how does this association work with mortality outcomes? And in part, we want to know how it affects the management of treatment. We're looking at, in our sort of body of work, we're looking at lifestyle outcomes, behavioral factors such as smoking, physical activity. And then I think ultimately we're hoping to look more at some of the physiologic intermediates that could explain some of these associations, the kinds of biomarkers or markers that are related to the development and progression of cancer.
Where can we go online and get some more information about this study, about colorectal cancer in postmenopausal women, and about what's going on there at Kaiser Permanente?
Yeah, I mean, that's a multi-part question with a complicated answer. But I mean, so if you want to learn more about the Women's Health Initiative cohort, that particular study has a website online. I think it's www.whi.org. If you want to look more at my research, if you look up my name or you look up social networks and cancer outcomes, that it's pretty straightforward to find more about this research. If you want to find more out about this particular paper, PubMed, this paper is already posted on PubMed. And of course, if you want to learn more about my work and this paper too, I think there's information on the Division of Research website at Kaiser Permanente, Northern California.
Thank you so much for joining us this evening on Health Professional Radio.
Thank you so much.
You've been listening to Health Professional Radio. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.